Tom Fankhauser. I'm a dentist here in Wichita, Kansas, and here today to talk to you about what's the difference between just a regular cleaning and a what we call deep cleaning or deep scaling or that sort of thing. Well, for the most part, it's a matter of degree or amount, the amount of material, the placement of it, or where we find it. If you're someone who goes to the dentist regularly and you build up a little bit of tartar on the back sides of your lower front teeth, the hygienist can go in and clean that off relatively easily, polish up your teeth. Then that's what we call regular cleaning. However, if you have not been to the dentist for let's say several years, and material or plaque material and tartar material has built up all around your teeth, and it's gotten down in under the gums, even under the gums between around the back teeth, you know, and it's all over the place and it's irritated the gum tissue, then the only thing we can do to get down and get after that is to do what we call a deep scaling. Now, technically they call it periodontal scaling and root planing, but we just kind of shorten that to deep scaling so it's not so confusing. And many times, you know, when that's done, it can be relatively uncomfortable, so we like to keep patients comfortable by numbing up the gums before we do that. There are, you know, how difficult it is depends on the patient and how difficult it is to get it to come off of the teeth. Sometimes that's relatively easy, sometimes it's not. Also, what it costs is going to be determined by how much of it there is and how far down it goes around the teeth. You know, if it's up towards the tops of the teeth or the necks of the teeth and it hasn't gotten down in deep, then it's not going to cost as much as if it's way down in there, you know, where you have to go down and scrape it from your toes. So you can prevent getting yourself in that position by going to the dentist regularly, having your teeth cleaned regularly. That is, twice a year. Some people can get by with once a year. Other people need to come in for that every 3 months. You know, and it's kind of determined on an individual basis. But most people can get by with a couple of cleanings a year, and it also gives the dentist an opportunity to check the teeth over and see if any of the fillings are cracked, you know, there's any new cavities, or there's been any soft tissue changes. We look for, we also look for any evidence of precancerous lesions. So there's a lot of reasons to go in twice a year, have your teeth cleaned and your mouth checked all over, and that's what we call preventive dentistry. It's a good thing to do for yourself. Thank you very much.